Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Today, I would like to present finding of our study entitled Self-Care Behavior and Frailty Syndrome Among Elderly Patients with Health Failure. Before I start my presentation, I would like to introduce myself. My name is Irna Rohmawati. I'm from Universitas Muhammadiyah Yogyakarta and School of Master in Nursing, and I conducted the study with Sarah Amalia. I also would like to thank to the Committee of International Conference on Nursing who conducted this fabulous conference. For the background, the number of patients with health failure is increasing every year in global and also in Indonesia. In Yogyakarta itself, the number of patients with health failure is number 5 across Indonesia. Most of the patients with health failure are elderly, and as we know that when we are become older, the functional capacity of our body will decrease, and elderly who have heart failure usually also have a comorbidity. And the decreasing functional capacity will cause a frailty syndrome and also the decrease of ability in self-care. So there is a question for our study that whether there is a correlation of self-care behavior with frailty syndrome in elderly with heart failure. For the study, we utilized a cross-sectional design, and we involved 87 patients from an outpatient into private hospital. So we approached the patient, and we will discuss, explain about the process later. But for the data collection, we collect a demographic data, for example, like the age, the gender, and also data related to the heart failure, for example, about the medication, and also whether there is other comorbidity or not. And for the frailty index, we utilize the frailty index questionnaire, consists of 40 questions. And for the self-care, we utilize a questionnaire that is developed specifically for heart failure patient called self-care heart failure that consisted 20 questions. So for the self-care, there is a subcategory for the questionnaire, including the self-care maintenance, self-care management, and also self-care confidence. And for the interpretation, we will consider if the patient have inadequacy in self-care, if the total score is less than 70. And we will identify the patient have adequate self-care if the total score of the questionnaire is more than 70. So for the patient, the total population of patients with heart failure in the outpatient clinics were 658 patients, and we utilize purposive sampling. We included the patients it's more than 80 years old with all implication and diagnosed with heart failure, and the patient who visited cardiology outpatient in the 2 private hospitals in Yogyakarta, and also the patient who accepted for being the participants in our study, we included in our study. So we approached 102 patients, and 25 patients were declined to be the respondent. So the total are 87 patients, and prior to filling the questionnaire, the patient was screened with the short portable mental status questionnaire to make sure that all the patients have a good mental capacity. And after that, we assess the self-care and also the frailty index using the instrument that I already explained in the previous slide. So this is the result. The mean age of the patient were 69, and age is not related or is not significantly related with the self-care ability and also with the frailty syndrome. And the proportion of the gender between the male and female patient were almost similar, and the education, most of the patient had elementary schools, and most of the patient have all of the patient actually have a polypharmacy, meaning that they consume or they have to consume more than one medicine in one day. And the majority of the patient also have comorbidities. In relation to the self-care ability and also the frailty syndrome, the majority of the self-care behavior were inadequate. So it's 98.9%. And about the frailty syndrome, the patient, the majority of the patient were in the prevail status. Robust in here mean that the patient had none symptoms about the frailty syndromes. So this is in line with the previous study that subject in or the respondent with heart failure usually were also in the prevail stage, about 70.4, while in our study the respondent who were in the prevail status were 71.3. And also the prevail stage could develop into frailty syndrome because the patient, the majority are more than 60, and the higher or the elder the patient, there is an increasing to develop into frailty syndrome. So for the relationship between self-care and a frailty syndrome, only the component of self-care management are significantly related with the frailty syndrome. This is in line with the previous study that most elderly found had a frailty syndrome because of poor diagnosis. And also from the study that individuals who are in the prevail states experience about 20 until 35% self-care deficit. So for the conclusion, self-care behavior in elderly patients with heart failure is still inadequate that we found in our study. And also the majority of the elderly with heart failure were in the prevail phase. And self-care behavior is not significantly related with frailty index on elderly with heart failure. So from our study, we recommend that nurses and other healthcare professionals should consider intervention to increase self-care behavior among elderly and also to screen about the awareness on the frailty syndrome. In addition, we also recommend that the nurses and other healthcare professionals also involve families to support heart failure management at home. I think that's all for our study, and these are the references for our study. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.